Well, good day. My name is Carol Lindsey. I'm a family nurse practitioner and a member of the Florida Clinicians for Climate Action, FCCA. And I'm very excited to be here today to talk to the Florida Public Health Association, you all, about public health and climate change. I have no disclosures. And the objectives today will be that upon completion of this presentation, the learner will be able to understand what climate change is, describe at least 3 ways climate change affects public health, describe what public health professionals' role is in climate change, and explain at least 2 types of populations that are more vulnerable to the health impacts of climate change. I'm going to try to explain to you as much as I can within an hour, but I just want you to know that there's so much more detail than what this presentation is going to cover today. So I really encourage you to investigate about climate change more and its health impacts. But here we go. So what is climate change? Well, according to NASA, it describes a change in the average conditions such as temperature and rainfall in a region over a long period of time. And what NASA scientists have been observing is that the Earth's surface is warming, and many of the warmest years on record have actually happened in the past 20 years. 2023 was the warmest year since global records began in 1850. So the Earth's surface is warming. This is a change in average conditions, and specifically with temperature, and sometimes this is referred to as global warming. Now, global warming refers to the Earth's rising temperature, and climate change includes global warming and refers to both human and naturally occurring effects on our planet's climate, things such as sea level rise or severe weather, drought, flooding, and many others. And it's also related to something called the greenhouse effect. This looks like a complicated slide, but this is from the National Park Service. And it's my favorite slide for explaining what greenhouse effect is. And so what happens is that on the left of this slide, we have solar radiation coming down to the Earth, and this is warming our lands and our oceans. But also there are naturally occurring greenhouse gases such as carbon dioxide, methane, nitrous oxide, water vapor. And these help trap the Earth's warmth. And this is evidenced by normal amounts of carbon dioxide is the main one, as illustrated by this left arc on the left side of the screen where it's a little bit thin, it's orange. And this is important that we do have carbon dioxide and some of these other greenhouse gases trapped in our atmosphere, these molecules, because otherwise our Earth would be freezing. And when we have normal levels of carbon dioxide in our atmosphere, more of the heat that's not necessary to keep on this Earth escapes back out into space. But on the right side of this slide, we see that we have rampant amounts of carbon dioxide. We see human activities such as burning of fossil fuels, gas for our cars, coals for our factories, whatever's necessary to run electricity. These are increasing the greenhouse gas levels, leading to an enhanced greenhouse gas effect, or like a blanket. You can see that the arc is much more thicker over the Earth, this orange arc. And this is full of molecules, especially of carbon dioxide. So what happens, it acts like a blanket over the Earth's surface in the atmosphere, and less heat escapes back out into space, and more heat is trapped in our atmosphere. And this causes this global warming, this extreme heat that we've been experiencing. So there's both human and natural influences on global warming that this graph is showing, but the most important lines that I'd like you to look at is the blue line and the red line, and in the center of those other squiggly lines. And the blue line is representing natural drivers, and we have on the bottom the years from 1880 to the 2000s, and then on the left, on the y-axis, we have temperature, showing temperature increases. And natural drivers such as volcanoes erupting or letting gases out normally while they're existing, and also there's solar and tectonic changes, and there's regular changes that are happening with our Earth that are contributing. These are natural influences to global temperature possibly getting warmer. But you see it's only going up a little bit with this blue line. But the red line that's in the center of all these squiggly lines, other squiggly lines, these are human drivers, things like greenhouse gases, which I just spoke about, the ozone getting hurt, land cover, when trees hold a lot of carbon dioxide in their leaves, and when we cut them down, like in the Amazon or even in the United States, this releases carbon dioxide up into the atmosphere also. So you can see that human influences are causing the temperature to go up higher than natural influences from this graph. And this is from NOAA, National Oceanographic and Atmospheric Association. And on the x-axis, it's showing thousands of years from 800 to up to 1950. And on the y-axis, it's showing carbon dioxide in parts per million, the quantity. And as you can see, for thousands of years, carbon dioxide levels have been at the most 300 parts per million, but then they started going up significantly since the American Revolution. But from this graph, since 1950, that according to this graph, it only goes up to to the early 20s. It's going up to like 418 parts per million. But I just checked yesterday, and according to NASA, it is currently at 423.85 parts per million versus last November where it was only 420. So it is increasing. It's showing that in the last three glacial cycles, this is reflecting what the temperature, the amount of carbon dioxide has been in our atmosphere, how it's been changing. So this graph is showing that carbon dioxide, which is represented by the green line, has been increasing simultaneously with the temperature, which is represented by the blue line from the 1880s to now. It just keeps going up. The temperature on our Earth just keeps going up, and that's why we're experiencing such extreme, and they believe that human activities are the biggest contributor to this. So simply put, the non-natural influences, why it's getting warmer, is because people all over the globe, this is a global issue, it's not just an American or a Florida issue, they're burning fossil fuels. These fossil fuels for electricity, for energy, for our cars, and for other things, and cutting down trees and other reasons why carbon dioxide and other greenhouse gases, but specifically carbon dioxide, the molecules are trapped in our atmosphere, creating that blanket where the heat cannot go out into space, and this is causing the temperature of our Earth and our oceans to get warmer. But why? Why is this heat so important to you all as public health professionals? Well, there's health impacts from this heat. Let's look at the CDC slide, and if you've ever attended a climate change presentation related to health, you've probably seen it. It's been in every one that I've ever seen, but it's great. It's very busy, but it's great. The middle of the slide, this circle is showing the physical changes that are happening to our planet. Again, increasing carbon dioxide levels are causing rising temperatures, and the next circle is showing the environmental effects that are happening. We're seeing more extreme heat. This is causing severe weather, increasing air pollution, contributing to increasing allergens, changes in vector-borne illnesses. It's causing changes in our food, our actual food content, and our soil. But I won't have a lot of time to get into that. But these are all the physical effects in that second circle, well, the third circle from the middle. And then the most important ones, the most applicable to you all, are the things that are happening outside of the circles. These are the health impacts, and we're going to go over a few of these today. But just briefly, like extreme heat, this can lead to heat-related illnesses and even death and cardiovascular failure. Or the increasing allergens can lead to respiratory allergies and asthma. Changes in vector ecology can lead to all kinds of diseases that are carried by vectors such as mosquitoes or ticks or fleas. And so let's jump into a couple of these. But before we do, and you as public health professionals know that there are some populations that are more vulnerable to different kinds of impacts, socioeconomic or things like this that influence it. But here, the ones that are more vulnerable to climate change, first of all, any of us can be harmed by these health impacts from climate change. But specifically, children, elderly, and people with disabilities, pregnant women, socioeconomically disadvantaged, people with chronic illnesses, outdoor workers or people that play outside, people with mental health effects, and other populations we're going to go into when we're talking about the specific environmental impacts that are happening, the populations that are more affected or more vulnerable. And you all have probably heard of the Social Vulnerability Index and maybe have used it. And this is by the CDC and also the Prevention and the Agency for Toxic Substances and Disease Registry Social Vulnerability Index. And as the slide says, and as you probably know better than me, I'm a nurse practitioner and you really get more into the details of public health, but it's a place-based index, database, mapping application, and it helps identify and quantify communities experiencing social vulnerability. So this is a tool that you all can use in order to identify which specific populations are more affected by the health impacts in your community or associated with the work that you do as a public health professional. And I looked on the American Public Health Association site, and they talked about the public health professionals' role in climate change. They have a specific section, I think it's called Climate and Health Equity, and they say that you all as public health professionals should focus on the prevention, detection, and management of the health implications from climate change. And also climate, health, and equity. Equity is an important part of public health also. And they go into a little bit more detail, actually a lot more detail, but generally speaking of this detail, that public health professionals, they work to understand and educate the public on the health consequences of climate change. They help communities prepare for climate, that prevention. Maybe they get involved in events about heat warnings, heat wave warnings, air quality alerts. Maybe if you're an epidemiologist or you're working with mosquito control programs, you might get involved in that, storm warnings, or detection, tracking, and management of emergencies. Again, epidemiology or some other career paths that you all have taken as public health professionals. But let's get into extreme heat, because it's been warming, it's been getting warmer and warmer, like I said, in the last 20 years, and last year was the warmest year on record so far. So how has extreme heat affected you personally and your community or with your job? You know, have you had to delve into the health impacts of this? These are things to think about with your specific role as a public health professional. Well, just briefly, heat-related illnesses include heat stroke. And by the way, heat is the leading weather-related killer in the United States. Even though most heat deaths are preventable through outreach and intervention according to the EPA. And also it's underreported. Someone might come into the emergency room with a heart attack, and it might have been triggered by the heat outside. And so it's not getting the focus that it should be. But anyway, heat stroke is the most serious. This is when the body can no longer fight the heat that it's experiencing. Now, with heat, we have temperature and we have humidity. And the combination of those two is called heat index, or feels like temperature If you have a smartphone, if you go on it, you'll probably see when it's talking about temperature, if you scroll down further, it's going to say, it's 92 degrees today, but it's 84% humidity, so it's actually feeling like 95 degrees. Or the meteorologist might talk about this on TV. The humid heat is much more dangerous for humans than the dry heat out west because the body has more difficulty trying to cope to this. So with heat stroke, especially as Floridians, we're practicing in Florida, this can happen because our core temperature gets so hot, we're not sweating anymore. Sweating is a natural way to cool ourselves down with heat, that we end up having a heat stroke. Our kidneys shut down, our heart shuts down. This is a medical emergency and people die from this. And then there's heat exhaustion, where our body is still fighting this heat. And maybe we're sweating, our heart's speeding up. This is bang, bang, bang. These are red flags. You better get some water in you. You better rest. You better get some shade. Heat exhaustion can lead to heat stroke. And then there's dehydration. We're losing more water. We're sweating out more water than we're maintaining in our body. This can lead to degraded kidney function. This can lead to fainting. This can lead up to heat exhaustion and heat stroke. We also have heat cramps. Maybe some of you have experienced them. They think it's because there's an electrolyte imbalance from the extreme heat, maybe from sweating, that cramps in our extremities, maybe our abdomens. And then there's also indirect illnesses. Like I said, somebody coming into the emergency room because they're having a heart attack, when this might have been exacerbated or triggered by the heat, or they're coming in with an asthma attack or COPD attack because it's gotten so hot outside that they're having trouble breathing. So again, this is a summary slide for you. If you want to go back, I'm sure you're going to anxiously want to wake up in the middle of the night and read this, the PowerPoint slides. But again, it goes over what we spoke about these extreme hot days that are getting longer. We're having more heat waves, the health impacts, which we spoke about, and that can lead to death, and mental health. This is an important health impact from heat. They've done studies, and suicides seem to increase more when it's hotter outside. People with issues like depression or bipolar disorder, schizophrenia, the heat seems to exacerbate that illness on them. And we get hot-headed in traffic. When it's really hot or we're hot outside, it's harder to concentrate. Students in school, it's harder for outdoor workers to work. So it can affect any of us. However, specifically, outdoor workers and athletes are really at risk because they're out there in the direct heat. And I want to use an example here. Think of agricultural workers that are out there. We were unsuccessful in Florida, as you know, of trying to get a bill passed to protect outdoor workers, where local communities could pass ordinances or regulations or laws to protect these agriculture workers, especially because they're out there in the heat, they're in long sleeves, they're in the direct sunlight. A lot of times, some of them aren't getting breaks, or they don't want to take breaks because they lose more money. I talk to them a lot of times. The water that's provided by their employer is right next to the toilets. The toilets are far away from where they want to go to the bathroom. Maybe some of you are working with outdoor workers or agricultural workers or migrant workers. So you are aware of these problems. Also, I want to mention briefly that I read an article in the Washington Post about these young Nepalese men in their 20s and 30s that went over to Qatar and Malaysia to work on those high buildings there. They were out there in the heat for over 12 hours. They were not taking water breaks, not urinating, not going into the shade, not resting. And when they returned to Nepal 6 months or more later, a lot of them had degraded kidney function. Some of them were actually in kidney failure and required dialysis. Nepal's a very poor country, so I don't know how many of them could have accessed this. But this is just showing how important the health impact from heat can be on people, especially like outdoor workers. Children, it's hard on them because they depend on adults to take care of them. They don't know if they're getting thirsty. They don't know if they're getting too hot. Also, their thermal regulation, the way they regulate against heat, is not as mature as an older person. Elderly, a lot of them have comorbidities like high blood pressure, cardiac problems, pulmonary issues, diabetes. They have trouble walking. They have decreased thirst. They are more susceptible to health impacts. Pregnant women, if you've ever been pregnant, you women on this call, you know how hot you are, and you're even hotter in the summer. I was pregnant in the summer. And so you may dehydrate quicker. Extreme heat has been associated in some studies with premature delivery, low birth weight children, all kinds of complications for pregnant women, socioeconomically disadvantaged, people that can't afford air conditioning. I don't know if you've experienced it, but as a nurse practitioner, people have to decide between paying for their electricity, their groceries, or their medicine. So they don't have them. And landlords in Florida are not required to provide air conditioning or working air conditioning, but they are responsible for making sure that the heat works. Unhoused people, people that are on the street that have less access to shade and accessibility to water, people with chronic conditions like I already spoke about, people taking certain medications, someone maybe that's taking hydrochlorothiazide, that's a diuretic that makes them urinate, that makes them more susceptible to dehydration. Antihistamines make people more sensitive to heat. And I've gone over the mental health issues already. So heat has some really big impacts. Health impacts. And this might personally affect you depending on what you are doing in your public health profession or in your community. Or since you've learned this, you may want to, in all your free time, go out into your community and talk about these things. So they have preventive measures regarding the heat, to rest, make sure they drink plenty of water, and to go in the shade. And what can you as a public health professional, again, do to help your community to adapt to this extreme heat? You can encourage them to stay in air conditioning. If you're working with the homeless, tell them to go to a mall if there's one close. Hopefully there's a cooling center they can go to. Make sure they're hydrated. Maybe encourage your community to put in those water fountains in more places. Heat alerts, make sure that those are going out on mass media, on radio, television. In Miami-Dade County, we were going through a trial period last year, and we had heat alerts go out on the TV. We got texts about them in the radio. That's something maybe you all can get involved in as public health professionals. There is this wonderful CDC heat and health tracker on the CDC website. Here is the link. And it has all kinds of information, especially for healthcare workers, to provide handouts to their community. You can go in and you can see what the heat's going to be like for the next 7 days. I encourage you to check it out. You can prepare your community by reaching out to more vulnerable populations and the homeless. There are, like in Miami-Dade County, that's where I'm from, a group that goes out in the extreme heat and they hand out water and they check on patients. Maybe you could get involved in designing something like that, or part of it, again, the heat alerts. Public health and local government resources, are those available where people can go in the heat? If you're on a committee or you want to get on a council locally, maybe you can talk about locating cooling centers close to lower income neighborhoods, or neighborhoods where there's more homeless, and shade bus stops, shade places where people sit in parks. That, especially with trees, it absorbs the carbon dioxide, gives you that great mental health effect a lot when you go into nature, and it provides shades. See if there's utility discounts for low-income people, socioeconomically disadvantaged people. Maybe if you're working in a hospital, you can have a sheet that can be handed out in different languages, if your community's like that, where people can get utility discounts for low income. Encourage your local community to provide those. And if you're working in the emergency room or you're gathering data, you're in a health department, maybe you need to start tracking that maybe some of these people that are coming in, again, like with a heart attack or something, this may be related to heat. And this information needs to be captured also. Now, severe weather like hurricanes and destruction, this is also exacerbated by the heat. They haven't found that the heat is causing these, but it sure is fueling them, because you probably have seen the meteorologists on TV talking about the temperature of the water, and they have it in the Gulf and the Atlantic, and they say it's getting hotter and hotter, and it's illustrated by being very red. Yes, that is gasoline for these storms. That's why we're seeing more Category 4 and 5, like Milton and the other storm that we recently had. And my goodness, it went all the way up to North Carolina. So they are contributing to more severe weather that we're seeing, and severe flooding too, because when it's hot outside, especially humid hot, that creates water vapor. This leads to increased precipitation, which leads to increased flooding, which some of you may have experienced on the West Coast, or we've all heard about it on TV. And look at North Carolina. Did they ever expect flooding like that? Their rivers were overwhelmed. We're going to see more flooding associated with severe weather in the future because of this extreme heat. There is a direct correlation with this. And you can think of how many of you were recently affected by the 2024 hurricanes. And where were you and how were you affected? If you could just put that in the chat box right now, and we can look at that in a moment and see what's going on with you, what your experience has been. But I'm just going to go on, and I'm going to explain a little bit more about this while you're doing that. Thank you. Again, this is a summary slide where it's talking about the climate impacts. The climate impacts, we're going to see more damaged infrastructure. You know, buildings wrecked, maybe places of where we work. I went through Hurricane Andrew in 1992, and it was amazing. I mean, Homestead Air Force Base was completely wiped out in Miami, and a lot of houses. I saw vans on top of houses. I mean, it was incredible, the infrastructure. And it affects water quality, that flooding. We had some really bad flooding in Fort Lauderdale a couple of years ago where there was raw sewage because it overwhelmed the septic system. With this flooding and the severe weather, we're going to see unintended injuries, people getting on ladders, trying to fix things, maybe falling off, going out in a storm, stepping on some debris, maybe with nails or whatever that's there, drowning if they drive into a flooded area, if their children wander into a flooding area, heat stress. You may lose your electricity, so you're going to experience heat. Because your air conditioning isn't working and you're working outside in this heat, trying to get your life back together. Infectious disease, if there's flooding and you walk outside and the sewers might have been overwhelmed, or you don't know what's floating in there and you have an open wound on your skin, or it's gotten into your water aquifers. That's a big problem and we're going to talk about that with sea level rise, with flooding. It might get into your water system. Respiratory illnesses, if a house is flooded and it's not cleaned properly, this can lead to mold, and also mental health issues. You're looking at your house and you're thinking, my God, I've got to pay a mortgage on it and I have to find a temporary place to live, or I can't get to work, or my work site is destroyed. What am I going to do? How am I going to sustain myself and my family? And it's going to be it can hurt anybody in that area, but mostly disabled and impaired mobility. Think of those people that are living in these high rises that are wheelchair dependent, or they can't walk well because they're disabled. And the electricity's off. They can't get down in an elevator. The elderly. They have all kinds of, as they get older, their body doesn't cope as well with the heat, or the stress might bother them more. Socioeconomically disadvantaged, they may be forgotten in the rescue efforts. They may not be able to get to places of help because they lack transportation. The unhoused, out there in the open. People with chronic conditions, again, if they have like heart conditions and they're looking at everything going on and they're breathing like this, it might exacerbate the issue. Or people taking certain medications like insulin. Maybe it's going to get too hot if they don't have a place to cool down. The air conditioning's not working, and it's not going to work as well in other medications that are heat sensitive. Floridians, we know we're bombarded by all kinds of free information every year just before hurricane season, when severe weather and extreme heat would be more pronounced during these times. So there is a lot of information out there available in English, Spanish, even Haitian Creole in the Miami-Dade area. So encourage your patients. Depends, again, what you're doing in public health. Maybe do some talks on it in your community. Have an emergency plan. Encourage your community or patients to monitor the weather storm. All of us have been through it, especially if you've lived here a long time. Floridians should know this, but maybe you have some visitors that are here or people new to Florida that should have all of these prepared. And if you're working with a healthcare, maybe in a hospital or a clinic, do you have backup generators if you lose electricity? What are the staffing plans? How are you going to get to work? How are you going to get, especially the very needed employees to work? Do you have contacts available for the vulnerable populations? And maybe you could get on the community forums and help advocating for a comprehensive disaster system with detection, tracking, things like this. And you can give input. Don't forget the unhoused. Don't forget those people that are more vulnerable, like those elderly in these buildings without electricity or people with low socioeconomic status. But let's just go for a couple of minutes to the chat box. Maddie or oh my gosh, if you or whoever else is monitoring this PowerPoint, can you please tell me some of the comments that are in there? We'll just take a minute or so. Okay, that's great. All right, well, hopefully some of this information is important to you. A lot of Floridians have been personally affected by this. A lot of Floridians have a second home in North Carolina too. It's really important as public health professionals that we can prepare our communities against what's going to happen, that they have a plan and other things that we've gone over. So sea level rise and climate change is important also. I mean, we live on a peninsula, and so we're one of the most exposed states in the country and even in the world for sea level rise and coastal storms. We have low-lying topography next to the shore and more than 8,400 miles of shoreline. So much of Florida and the coastal population are vulnerable to the impacts of sea level. Just think of all those condominiums and houses on it. And this is showing the global average absolute sea level change rise from 1880 to 2023. This is throughout the world. This is an average like of the ocean. So from 1880, you can see the level of change in inches on the x-axis, and then the y-axis and the years on the x-axis. You can see that it's been climbing into the 2020s. It's gone up to about 10 inches. And this specifically is relative sea level change, and this shows the height of how the ocean rises or falls relative to the land at a particular location. Like look in Florida, you can see that it's gone up about, it's the mustard color, it's not the super orange one. So it's gone up about 3 inches according to this graph here. And you can see, like out in Texas and Louisiana and other parts, they're even more affected. But there is sea level rise. And what happens with sea level rise is it's getting warmer, so it's melting snow and ice that's already on hard land. And this is going into the ocean, and it's increasing the sea level. Also, when water warms, it causes the water to expand. And this also contributes to sea level rise. It's not a contributor of these glaciers and other things floating because it just displaces the water. That doesn't contribute, but anything on land that's melting, and it is melting, and it's melting faster than they thought in Greenland, Antarctica, and other cold places, it is contributing to the sea level rise, this extreme heat. So again, the climate impacts, coastal and inland flooding, shoreline erosion, saltwater intrusion. As sea level rises or with flooding, it can cause freshwater contamination. In Miami, we have an aquifer that we depend on. and it is very affected by saltwater intrusion, by sea level rise. And again, like I talked to you, it's just that it can hurt the infrastructure if it rises. We all probably have seen those YouTubes of these places in North Carolina that are falling into the ocean. We may be starting to see more of that, especially like in the Keys and anyway, coastal areas, and damage to infrastructure. So you can have unintended injuries. Again, somebody's in one of these houses is going down, or the flooding that's happening, possibly drowning, waterborne illnesses with sea level rises if they're drinking contaminated water because we've had saltwater intrusion, infectious disease. As the water rises, it may be absorbing things that are on the land that are chemicals and getting into the water. Someone walks in that, infectious disease, respiratory, mold again, if water gets into their house, mental health, because people are observing, oh my God, my house, look, the water's coming into the building now. Where am I going to live? What am I going to do? So the most harm, the most at risk, again, are coastal communities, disabled, impaired mobility, because they can't get away from it easily. Because of their physical issues, or mentally. Also, they could be disabled mentally. They could be showing a dementia or and not have good judgment about this. Elderly, they're on fixed incomes and now they have to move, or they have to raise the prices because of possible flooding and they can't afford it. Socioeconomically disadvantaged fall into that. Unhoused that live close to the water, or people with chronic conditions. They get more stressed out, mental health, when they're looking at these kinds of things happening. So sea level rise, what can you do as public health professionals to help patients in your community to adapt to the sea level rise? Well, again, you can advise people what to do before, during, and after flooding or from sea level rise. Maybe encourage people to get flood insurance. Those poor people in North Carolina never, ever thought they would need flood insurance, unfortunately. But a lot of coastal communities require it. That is more peace of mind if they can afford it. Have a plan to relocate if necessary. If the flooding's starting, people should really start thinking about that. And utilize landscape like mangroves, maybe put mangroves, because those kinds of natural habitats hold the water away and hold the land, so it doesn't really erode as easily. So you can encourage your community and policy to elevate roads and water pumps, to have water pumps. If you, in your public health profession, in your particular position, maybe you could be a consultant on that. Seawalls might work in some areas. Again, natural coastal protections. Have contact information readily for most vulnerable patients. Maybe there's something where the government will buy their land so they can move, probably not at the best price, but that would give them some flexibility maybe in moving before the sea level rises too much. And advocate for comprehensive sea level rise management, especially for those that are socioeconomically disadvantaged. And these are just a few things. There's more things that can be considered. Now, changes in vector ecology, vector-borne diseases we're seeing. And vectors are spread disease, you probably know, like mosquitoes, ticks, fleas. And so they believe that this is going to increase because the climate impacts from vector-borne diseases increased number of vectors like mosquitoes, ticks, and fleas. Mosquitoes and ticks love the heat. So when it gets hot, they bite more, they increase their incubation period, the incubation period decreases for their larvae to develop into mosquitoes. So they populate quicker. They're finding that it's staying warmer longer, so they're being around longer, mosquitoes and ticks. And also they're expanding their geographic areas because it's warm in places that used to not be warm. Maybe in northern Florida, we'll be seeing that more. In Florida, it's pretty warm. South Florida, Central Florida all the time. So they're expanding their territory, their metabolism, and they're having longer seasons. And what we're going to see are some health impacts. Some of the human illnesses specifically to Florida are Lyme disease, ehrlichiosis, Rocky Mountain spotted fever, and other spotted fever illnesses. If you work at a health department, you may be seeing an increase now or in the future. Again, who's being harmed? Anyone, but certain populations, and this is not totally inclusive, face a greater risk, like children, because they need people to protect them, and they play outside a lot more than other people. And so they need an adult to put mosquito repellent on them, or to not have them go out at certain amounts of times, and to check them for ticks, or to see if a mosquito bite is infected. The elderly, just because, again, their body is not as strong as it used to be, they may be more susceptible to a worse reaction to one of the human illnesses that is caused. Their sight might not be as good, or they may be feeble, or they may have dementia, so it may be harder for them to see ticks if they've been outside, little ticks, in order to remove them. Chronically ill, because their immune system, their body is not as strong. If they got Lyme disease, for example, they may have a worse reaction because their body isn't able to fight it as well. And outdoor workers, of course. If you're working with people that are outdoor workers, like National Park Service or landscapers, or people that are cutting yards, things like this, maybe you could talk to them about these changes and how to protect themselves, in which parts of the day they may be more susceptible to getting bitten by these vectors. So also, what can you as public health professionals do to help patients in your community to prevent vector-borne illnesses? Again, it depends on what your role is in public health. However, you as a public health professional can always maybe incorporate it into a current job that you have, some of these ideas. So you're going to advise the patient. Some of these are very common sense, to use insect repellent, long sleeve shirts and long pants and hats. People that are constantly outside, or people that are camping, if you're working with patients, or you're working at a campground for some reason with maybe the National Park Service, you may want to encourage these people that are outside all the time to treat their clothing, their tents, things like this with permethrin. Control the fleas and ticks on their pets if you're working with patients or your community, and show them how they're able to find and remove ticks on their pets, and how they remove them on themselves, because you don't want to leave the head of the tick in the skin when you're removing it. And then to take steps to control mosquitoes and ticks, not to leave standing water around, and fleas outside the home too. So you want to prepare the community how they can protect themselves from diseases resulting from an infected mosquito, tick, or flea bite. Again, the things that you can advise a patient to, the same ones. Be aware of the vector-borne diseases in your community. If you're an epidemiologist, you may want to monitor more closely if there's going to be patients presenting with mosquito-borne illnesses or tick-borne illnesses. Maybe work as a consultant, or actually develop policy, practices, and resources to start preparing for what may come, because it's getting so hot, and to educate the public on testing and mosquito control programs. Very public health, very important. So these are just some ideas, and I'm sure you can think of others. Now, we're seeing an increase in allergens too, with the heat, because as it gets hotter, a lot of plants and trees bloom more, and some of them even like carbon dioxide more. So if there's more carbon dioxide in the air, like for ragweed, that may increase the pollen in the air. And this is one slide from Climate Central that's showing, for example, currently the pollen in the air goes up to about 8 grains of pollen, and this is in millions, okay? But by 2060, if the carbon dioxide rises to 600 parts per million, we could see up to 15 million grains of pollen in the air. We can experience that. Right now, it's at 423 parts per million, so hopefully it's not going to get too much higher. But I don't know. It's up to the globe. It's not just up to Florida or the United States. Everybody has to participate in decreasing the human activities that contribute to this increasing carbon dioxide, which is increasing extreme heat, which is increasing more pollen in the air. Climate impacts. Some of my nurse friends have told me, nurse practitioner friends, that they're seeing patients come in earlier than normal with bad allergic reactions or allergies because we're seeing longer pollen and allergy seasons because it's not cooling down as quick as it used to. We're seeing increased pollen concentrations because there's carbon dioxide and extreme heat that's causing that. And damp buildings, we have to remember always that if there's flooding or sea level rise, something that has caused the walls in a building or an infrastructure, and it hasn't been properly treated or torn down, we may see mold, and mold can lead to allergies. So, of course, the health impacts are common sense: respiratory allergies, respiratory illnesses. Somebody has COPD or asthma, it could exacerbate that issue. Hay fever. Maybe some of you have allergies. You know how it feels if your eyes are watering, you're sneezing, you're coughing. You could have allergic rhinitis, allergic conjunctivitis. Your eyes are watering. Any of us can be harmed by this increasing pollen, but again, elderly are more susceptible because they may have comorbidities such as pulmonary disease, and their body is not functioning as well as when they were younger. Children with asthma or persons with asthma, the pollen can exacerbate an asthma attack. People with respiratory problems, COPD or other respiratory problems, may have more issues when there's a lot of pollen in the air. And socioeconomically disadvantaged, those people that don't have access to air conditioning, so they can't close their doors if there's a lot of pollen in the air, or they don't have screens on their houses. So things like this, if they're socioeconomically disadvantaged, they may not be able to afford to do things, maybe even if their building or their house was flooded, to resolve that issue. And there's other people that can be harmed also. So what can you as a public health professional do to help patients and your community with respiratory issues from allergies? You can advise the patients to check the pollen forecast on local news, phone, and online services. In fact, sometimes it's on your smartphone. So anybody that's more susceptible, if you're working with that type of community, or you yourself or your family, you may want to tell them, hey, listen, you better watch out for those things. Spend less time outside when the pollen count is high. Take any kind of medications they normally take that is okay by their healthcare provider, because you have to be careful with certain medications, especially if you have cardiac problems or pulmonary problems. There can be interactions. So if you're not a clinician, you want to be careful with that. But if they're already taking approved medical allergy medications, they can continue. Some are common sense. You don't touch your eyes, you take off your clothes, you put on new clothes, and you take a shower after you've been outside. And if your community can afford it, that they use high efficiency filters in their home heating and cooling air vac system. You can prepare your communities by educating the public about these increased allergens, develop policies, practices, and resources. Get involved in that. Bring that up wherever if you're working in a university, maybe talk to the clinicians about this. Hey, climate change is going to be affecting allergens more. What can we do to protect our students? Have educational handouts available and have them in multiple languages depending on who your community is. And advocate for landlords to provide working air conditioning. Advocate for laws on that, and good window screens for these tenants also. So these are just some ideas. So we have finished the most important part of what I was going to present, but just briefly, there are some important climate change terminology that you may run into in the literature if you start reviewing it or you hear about it. There's something called mitigation, and this is reducing climate change, the flow of heat-trapping greenhouse gases into the atmosphere. So if we can reduce how much we burn fossil fuel, let's try to take mass transportation. Let's try to use our car less. If you can afford a hybrid or electric car, you may want to consider that. There's something called sinks. This is where greenhouse gases like carbon dioxide are stored. This includes, like I mentioned, the forests, the trees. Let's encourage people not to cut down trees, or if they're going to plant trees, instead of planting a palm tree or something with few leaves, plant something with a lot of leaves, which will absorb the carbon dioxide. Our soils hold that in too. When we till it, when we turn it over, that releases carbon dioxide into the air also, and other greenhouse gases. Adaptation, that we adapt to a life in this changing climate. We've been talking about how we can get our patients in our community to adapt. That's what's happening. And we want to do this. We want to adjust to actual expected future climate. Some ideas is a cooling center where there's a low socioeconomic community, so they can go there, or they can get on buses and go to a mall close by. And since it's going to be warm longer, maybe we can take advantage of these longer growing seasons to grow products that we can use. And that's a whole other area about climate change, how it is affecting our plants. It's changing the content, the mineral content of our plant. This heat and drought, it's going to cause issues in the future about growing plants and having animals outside. By the way, they are also affected by extreme heat. Climate resilience, successfully coping with and managing impacts of climate change while preventing those impacts from growing worse. Helping communities adapt to climate change. Like, hopefully you'll be able to take a part in this. Hopefully this presentation helped you think about ways that you in your specific role can do that. And sustainability, meeting the needs of the present without compromising the future to meet their own needs. So think about it, reduce the amount of things you need. Do you really need it? We're such a consumer society, to make all this plastic, even these plastic bottles that we drink water from, that requires energy. Energy is made using coal or fossil fuels, and that releases carbon dioxide in the air. Reusable bottles. Reuse things like some of the plastic. If you end up bringing it, using it, reuse it to store things and recycle. If that really works, hopefully it does. So that concludes my presentation. I wanted to leave time for questions, but I do have some resources here on climate change that I encourage you to check out. There are the links here with some of this information. My Green Doctor has a lot of handouts. Also, remember climate solutions, clean energy, wind energy, electric cars. This creates less pollution, healthier air. These are other things: diet with vegetables, less meat, or healthier. Takes a lot of land for a cow to create that meat. And they release methane when they fart, when they poop, when they burp into the air, and other greenhouse gases and other things. Green trees, more trees in our community. This is a acronym that you can use for climate impacts from Florida Clinicians for Climate Action and Medical Consortium. H for heat illness, E for exacerbation of heart and lung conditions, A for asthma, T traumatic injury, W water and waterborne illnesses, A for allergies, V for vector-borne, and E for emotional sources. And then these are more resources. I'd be happy if you needed more information, or if you need someone to do a presentation to your community. Here's my Gmail. If you have any questions, please let me know.